All right, let's get started. If I figure out, how to get rid of this. There. All right, so welcome to the webinar, Developing an Evidence-Driven Local Reform Initiative. Some of basic housekeeping. To hear the audio, you can connect this by a computer or by telephone. And in order to call in, I have the call-in information on the screen, but also on your control panel, you should have access to either choosing enter by joining by computer audio or phone call. And if you click phone call, it should also give you your call-in number, access code, and also an audio pin. All of you are currently muted just to make sure that the quality of the webinar is not affected. And also, in order to ask any questions, you will be able to enter that in the control panel, and we'll monitor it as we go. So this is a very quick look at your control panel. On the top, you'll see the dial-in information, and then under the questions box, you will be able to type in your questions. And a little bit about myself. My name is Amber Thorne. A lot of you, if you came through the certificate program after 2015, you probably know me. I started working at CJJR in 2015 as a program coordinator, working with the certificate program team here at the center and working very closely with program participants to develop your capstone projects or a local reform effort. Currently, I am a research associate here at the center. In addition to supporting the certificate programs, I also manage the Fellows Network, which is a network of professionals who have come through the certificate program, have submitted their capstone proposal, and are currently implementing a capstone project or have implemented a capstone project in the past. I also work with teams to make sure that they have evaluation components embedded in their reform effort, making sure that during the proposal review process, it's all taken care of. I also manage the Knowledge Lab. That's a new development at our center. Through the Knowledge Lab, I have the capacity to analyze past and current data, to develop resources for the professionals in the field, bridging the gap between research and practice. I develop resources such as webinars like this, issue briefs, etc. And a little bit about my background. I did my undergraduate in psychology at the University of Maryland's College Park. I have my master's in education from the University of Pennsylvania, and I am currently pursuing a second master in mathematics and statistics, formalizing my interest in data analysis. Well, that's a little bit about me. Now moving on into the main components of our webinar today. So through our webinar today, you will learn about the key components of project evaluation. We'll discuss some of the most prominent overarching themes and goals of some of our certificate program fellows reform efforts. You'll learn a little about how reform goals and outcomes can be quantified and measured with examples. And also, hopefully, we'll be able to give you some of the tools and resources that can help you in the process. And I also want to note that this webinar is introductory. And so the content in terms of data performance is a little more on the rudimentary side. And so no jargons, nothing that you don't need an advanced mathematics degree to understand. And so here is steps of key components of the program evaluation. There are 5 of those. The first one, assessment of needs for program. This is really looking at the what and why, identifying issues and identifying gaps of needs in your jurisdiction for your population. And then the second one, assessment of program concept and design. This is identifying your theory of change, which is, does A lead to B? And this is looking at the question from how, when, and where. So how do we do this? When should we do this? Where do we do this? This is, if we do A, does it lead to B? So as an example, if we do risk assessment, will it lead to better outcome for youth? And the third one is assessment of program implementation. This step involves developing an action plan and carrying it out. The fourth step is assessment of program outcome and impact. It also involves aligning your goals with measurements. Hence, you will be able to measure your impact. And then the last one, oops, you might not be able to see it here. Oops. Is assessment of program cost and efficiency, which is a cost-benefit analysis. And for today's purpose, we're going to focus on number 3 and number 4. Assuming that you're already planning to or in the process of implementing a reform initiative. And we will go into all of this in detail just in a little bit. And so all of you are here, obviously, because you're interested in evaluation and understand its importance. But here I want to mention this to give you a quick elevator speech to convince your boss, your colleagues, and your staff on the benefits of and purposes of program evaluation. First, it provides you information to present to external partners to get buy-in, to gain trust, to obtain funding, which is very important. So you're sharing this information and showing that you're being accountable for the resources, activities, and or results. And then also on the internal level, this information can be used to improve program design, to look at what are the issues during your implementations and how do you do better. That's the second bullet point. So for accountability, that's for external partners, and program improvement, that's internally for you to improve your program. And so this is breaking down the 5 steps that I mentioned at the very beginning. The first one is assessment of need for a project or program. And this is looking at the what and why. And assuming that you already have a plan for your reform initiative, you have already done the need assessment. And then in terms of assessment for program concept and design, looking at the how, the when, the where. This is looking at your theory of change. What is your theory of change? If you do this, then that will happen. If we improve our diversionary practices, less youth will be arrested. That's your theory of change. And also I want to mention, this is really about beginning with an end in mind. And I stole this from Stephen Covey. This is begin with an end in mind is the second habit of his 7 habits of highly effective people. It's a great advice for personal productivity, but it is also a golden rule that applies to program design. You want to look at what do you want to achieve? What does that achievement look like? You paint a picture, you set the goals, and then you can try to quantify the goals and be able to measure it along the way. And then the third one, which is one of the key components, is assessing program implementation. You are looking at if you're doing what you said you're going to do, and are you doing it well as you plan to. And it provides an early warning sign, an indicator for any potential issues that may occur. It also provides you with information that you need in order to improve the program. Some of the main themes that we have seen in our Fellows reform efforts or Capstone Project, there are 3 big parts. First one is to improve interagency collaboration. That includes things like improve information sharing, have a smoother transition or handoff of services for youth when they move from one agency to another. The second one is to improve workforce development. That is to train staff and maximize staff's positive impact in addressing juvenile justice and related issues. The third one is to improve policies and protocols. That is to ensure that they are there to protect youth's rights and to provide standardized framework for staff to follow. We will touch on all of these and how you might be able to quantify these later today. And a very, very special note is that you cannot assess impact unless you know your project is being implemented with fidelity. So for example, if my theory of change is diversion programs will reduce arrest rate, but if staff isn't using diversionary practice, you can't reasonably expect that the arrest rate will go down. the chain has been broken, unless there are other things that's happening in your jurisdiction, but that has nothing to do with your project. And so it's extremely important to make sure that your program is being implemented with fidelity, and that your staffs are following all the protocols and the guidelines and framework in order to even think about if your program is effective or making an impact or not. And so the fourth component, assessing program outcome and impact, this is looking at this is providing you, this has to be done under the assumption that you have indeed implemented your program or project with fidelity. So now that that's out of the way, you want to see if you're actually making impact on the target population. And some of the measurements, for example, the pre-post time series, comparison measures, those are some of the non-expensive and relatively easy methods to gauge your impact or your outcome. An example for pre-post, for hard data, you might look at recidivism rate before, during, and after a program or services. To see if you have made an impact in terms of youth recidivism. Or maybe you want to look at some soft data or survey data, like parents' self-reported satisfaction with your agency or staff before and after you made a change. Say, for example, you made a protocol change in how your staff should engage with parents, and you did a series of trainings about parent engagement. And ideally, you would be able to see a difference in the parents' satisfaction survey for how your staff work with them. And then an example of a comparison measure is, say, School A and School B, they have similar youth demographics, and School A received intensive restorative practice training. School B doesn't. And then you look at the outcome. Does School A students have a lower arrest rate compared to School B? So that would be your comparison data. Those are relatively not expensive, and a lot of our fellows have been doing that even without outside contracts, say to have an evaluator to come in and do this. It does require some resources and designated staff, but for the most part, this is relatively straightforward. And then also, we want to encourage you to consider unintended impact. So for example, you started a diversion program that requires, say, parents' attendance, but some of the parents might not be able to attend the diversion program with their kids because their the work schedule, their transportation difficulties, or illness, or any other reason. And then this program could disproportionately exclude a certain subgroup of youth, perhaps youth with lower SES or youth of minority or racial minority. And so whenever you are looking at a program outcome, you also want to see if there is any unintended impact that might be co-occurring with your original plan. And then assessment of program cost and efficiency, the cost-benefit analysis is looking at, is this program worth it? How much money did we spend? And is the outcome in proportion to how much we spend? This is rather high level, and we will not be going into this today. And so going into assessment of program implementation and program outcome, which is number 3 and 4 on the steps. So this is a very simple reduced form of logic model. You have your goals, which is what will your program accomplish. You have your inputs, which is what resources are needed to run the program or run your project. Things such as partnerships that you require, staff time, money, knowledge and skills that's specific, or maybe technology. And then when you look at the output or activities, what is the program designed to do? And what are the steps required to achieve this goal? Basically, it is how will you use the resources? And that includes, you want to look at your target population, the action steps, and if there are any deliverables that needs to be done. And then when you're looking at outcomes, you have initial outcomes all the way to ultimate outcomes, and then somewhere in between the intermediate. It may not apply to everyone's project, but the initial and ultimate is definitely something everyone would have. This looks at what actually happened after your implementation. And this relates back to the goals. Does your outcome match your intended goal? Did did your program say, did your program change what you think it was going to change? And then a quick word about setting goals. I think most of you must have heard of SMART goals. I choose specific, measurable, assignable, and realistic, and timely. Specific is that your project should be very targeted and quantifiable, which is measurable. And I say assignable because reform efforts in juvenile justice generally require multiple teams and even multiple agencies to collaborate. And so it makes sense that it is incredibly important to make priority to make sure that each person or team or agency has a designated role. But assignable, the A, sometimes people also use achievable, attainable, action-oriented. Those you could use it interchangeably based on your specific project. And realistic. So there are other words that people use for SMART goal for R, such as relevant and resource or result-based. But I chose realistic because I've seen a lot of teams often have very ambitious goals, but they don't necessarily have the resources to achieve that, such as partnerships, leadership or administration support, or even funding. So making sure that your goal is indeed within your reach and sustainable is extremely important, and hence I chose realistic. And then timely, to have time frames. It's extremely important that you know when to accomplish something so you can reflect on your progress. It could be in stages or tiers. You can have a 1 year and a 3-year strategic plan, and so forth. And then in terms of the outcome measures, it should be easily understood. You should know your audience and minimize the jargons. Don't make it really difficult for folks. Don't scare folks off. Accurate and unambiguous. So for example, recidivism. The definition of recidivism varies from state to state, from county to county, and even from agency to agency. And in order to measure recidivism, you would want to have a very specific measurable way to define recidivism. Valid is measure what it is, and that measure what you intended to measure. And feasible is basically it's doable. If you know you don't have the knowledge or skills or capacity to, say, do evaluation, you maybe want to look for an external partner, such as universities, interns, professors who are looking to mine data, or researchers, or if you have the funding, an outside evaluator. And then more on measurements. So quantitative data is the data that can be expressed in numbers. Things like how many, how much, how often, how many youth we've served, how much progress they have made, how often are the stakeholders meeting. Qualitative data are data that's categorized and talks and discuss characteristics. It provides you with in-depth information about the content. So for example, how or why are some of the questions. And then you would also usually you would do a thematic analysis to look for common or reoccurring themes. And so this is a little more about that. Quantitative data, you have your score-based assessment tools such as behavioral health record or risk assessment information. You have your agency records such as GPAs, number of arrests, number of youth that you have, families that you have reunified, and also those measurements can also be obtained from surveys with closed-ended questions. So for example, how satisfied are you with our services to your kid, from 1 being not satisfied at all to 5 being extremely satisfied. And then you could also do qualitative data. That's usually, the why and the how. And you could do that through interviews, focus groups, survey questions that's open-ended, and also in some cases, case studies. I also want to bring up a few considerations when you are looking at data evaluation. So what types of data do you currently have available, and what kind of data that you actually want? This is kind of like the need assessment. So what do you want? What do you have? And what more do you need? This is really I encourage you to think about this because this will help you eliminate unnecessary duplication of efforts. So for example, if your child welfare collects school data and are able to share the school data, perhaps you can work something, the juvenile justice department can work something out with the child welfare. They can share data instead of having to collect it again with more work. Also, who will gather, analyze, and report the data? That's extremely important to think about as that looks at the capacity. So maybe you want to do it with an external partner, such as a university program or a professor. Maybe you have internal staff who has data analysis background and experience and can take on that project. Or perhaps you have other agency partners who have a data department that you would be able to utilize and partner. Or maybe within your department, you have a small section that has a data analysis unit. That would be amazing. You will also look at how the data will be collected. That goes back to the qualitative and quantitative. Are you going to do self-reports? Will you look at agency records? Will you do interviews? Or maybe you want to look at historical data mining. Also, another point of contention is where will the data live? Will you be manually entering it into Excel spreadsheets and then share it with key partners? Will you be using a data sharing platform where multiple partners and agencies will be able to enter the data and everyone will be able to have access to it? Are you going to do something that's more paper-based? And most importantly, and also always a point of discussion, is who has access. So this, you probably will have to look at your local laws and policies to look for guidance in this regard. And also, this is extremely important. What will be done with the data? So data collection is a very time-consuming and it's an effort. So how will you use it? Will you use it to share with your stakeholders and gain buy-in and to improve collaboration? Will you incorporate it into your, say, 5-year strategic plan? Or will you use it to pinpoint programs' area of improvements and to make policy or practice changes? Those are the things that you have to think ahead of time. And so you know exactly what kind of data you're looking for and what will be used with it. And so what types of data are we looking for? How do we quantify such information? And so here I want to stress the word impact. Impact means changes. When you look at evaluation, you're not only looking at the outcome, which is the concrete number, but you're also comparing it to something else. You're comparing it to, say, in a pre and post test, you're comparing the post data to pre-implementation data to see what impact or what changes you have made to the population that you intend to change. And after analyzing all the fellows who are focusing on their own local reform effort, we found 4 main themes that we have mentioned a little earlier. There is the policy and practice changes that they're looking to make. There is interagency collaboration, staff training and professional development, and also variety ways to improve, expand programs. And so for policy and practices, most of the folks that we work with, they look to revise an existing policy or to develop something new. And when you do that, we want to know what has changed. And are those changes actually being implemented, or is it just a written something that's in a pile in piles of paper, but no one actually knew about it or has done anything with it? And so ways to measure that, you could simply just list the changes. You might not be able to quantify, that we have developed an MOU or we have implemented a diversion program, or I'm sorry, we have changed, say, a school code of conduct, but you can list out all the rules that you have changed. You could do surveys and interviews or focus groups to learn about how the changes are being implemented, how they're affecting people. And you could also look at behavioral observations and evaluations. This part relates somewhat to staff training, because once policy and practices are changed, staff are the ones who are carrying them out. And so that's part of this, but we will talk more about that later. Later as of now. And so when you look at workforce development, where a lot of our fellows are working to develop curriculum that's on training or implement the training. Some of the more popular topics are trauma-informed care, restorative practices, parent or youth engagement, de-escalation. And we want to know, does the curriculum match what the staff needs? Maybe all your staff are experienced counselors and they don't need additional trauma-informed training, and to them that doesn't add value. And so you want to survey that and understand what the needs are. And then you want to look at, are the staff actually attending the trainings? Are they retaining the training content? And are they using the training content in their work? And so some ways to measure that include, simply listing the training topics so we know the areas that you have covered, number or percentage of staff that have actually gone through the training, pre-post evaluations of staff's knowledge and skills. In terms of the pre-post evaluation, I also want to caution that some folks might think that they are competent and have a good understanding of a topic, but once they go through the training, they realize that, in fact, they don't know the deeper issues. And so in that case, oftentimes people would rate their pre-survey, pre-evaluation score higher and post-evaluation score lower, just because they knew more and they knew how much they didn't know. And so depending on the topic, you might want to do a post-retrospective evaluation. That means instead of asking folks to do an evaluation of their knowledge and skills before the training, you ask them afterwards, but you include questions such as how much you have improved, or before the training, how much you did know, and now how much do you know on this, like in terms of your knowledge on a specific topic. You might want to do post-training surveys that's with a time lapse. So for example, if you have a training in August, maybe by December you want to evaluate if the staff are actually retaining. They still remember what the training content is, and more importantly, are they using it when they work with kids? Behavioral observation and evaluation, that can be done by supervisors, peers, youth and family, and so on. Okay, so on interagency collaboration, developing a multi-agency agreement is a very popular item because that ensures you have sustainability and you have buy-in, and in the MOU, everything is laid out, all the roles and expectations are laid out very clearly. And another very popular topic is to form cross-system or multi-system work groups where people from different agencies get together and they talk about issues and they develop policies and training curriculum and all that we just have talked about. And when you are working to improve interagency collaboration, we also want to know what has changed and what's the purpose of your interagency collaboration. For the most part, it's to see if the groups is to facilitate groups to communicate more often and at a deeper level. So ways to measure that include, listing all the changes that you have made, the groups that you have formed, the subgroups you have formed. You might want to survey or interview the members of your work group to see if you have indeed facilitated something more. Are they having better understanding of each other's missions and goals? Are they working? Do they feel like they're working together? You could do behavioral observations, looking at having, say, people rate their peers' level of engagement within a meeting. You can look at the number of meetings that take place. That's quite simple. You just have to document all the meetings that have taken place and how long it took and who has participated, which agencies have participated. And also any deliverables that you had developed through the collaboration. Maybe it's an MOU, maybe those are some interagency information sharing agreements, or perhaps they are a framework or a guidebook that guides multiple agency staff to communicate and work together. And last but not least, this is probably one of the most widespread area that almost all our fellows are working. They're always working to improve or expand a program that's delivering services to you. And so with this, we want to know how many youth you have served or family you have served, and what are the youth outcomes? Are the youth actually doing better with your program's intervention, or are they not? We want to look at this relates to pretty much everything we have talked about earlier, the interagency collaboration, the workforce development, and also any policy and practice changes. They all funnel down into how a program is run. Is it being implemented with fidelity? Are the staff delivering the services that you intend to deliver? And then that all comes down to how the program is. And so this is a lot more complicated. This includes a lot of the information that has that it's being built on from all the previous information. But in terms of population level outcomes, we want to look at program implementation data, which is, the interagency collaboration, the workforce development, the policy and practice changes that we talked about earlier. And then also juvenile justice outcomes such as recidivism or recommitment rate, child welfare outcomes such as number of reunifications or placement, education outcomes like GPA, school behavioral incidents, students' attendance. You can look at psychological and behavioral health outcomes if they are receiving related services. You can do that through mental health assessment or drug use assessment. And then it's important that, if possible, we highly recommend you to disaggregate your data by subpopulations such as SES, racial minority, sexual orientation, special ed needs. Those are groups that oftentimes suffer from unintended consequences by a program, and it's important to keep an eye out just to make sure that whatever policy or program that we're putting out does not negatively affect the subpopulation. And so here I have listed some resources that you might be able to use. I'm not going to go through them here, but I have it listed here, and we will upload all the information. I think we'll email the PowerPoints to you, and so you will have this with you, and you'll be able to check out some of the websites and articles and tools that helps you strategize and making sure that you are embedding data and evaluation into your reform effort. And so logic model. If for the 2018 and beyond fellows, you have definitely heard of logic model because we go through this with you during the program. But for those who are from 2017 and before, we don't actually do this during the program, and so this might be new to you. But the logic model is basically what we did with, if I can find it real quick. This. It will look at your goals, your input, your output, and your outcome, and to make sure that everything is logical and has a flow and they are related to each other. And so your activity actually complements your goals, and you can look at your outcomes to evaluate if your goals are being met. And so here we have one example actually, that I want to take you through. So this is an example from Oregon. Their Capstone Project or local reform effort is to reduce the rate of recidivism and recommitment for girls on parole transitioning into community residential placement. And ultimately, they want to reduce recidivism and residential and recommitment rates. And so to do that, they have three strategies: to review, continue, to improve information sharing, to improve case plan development process, and to improve family engagement. And so for the logic model, the first one is to improve system collaboration or information sharing, to improve case plan process and quality, and to improve family engagement. And once you have done all these, hopefully it will result to improved quality of services that's provided to youth. And if that's the case, then youth treatment needs are being met. And if that's the case, sorry, this is hard to see for you. Ultimately, it will have improved public safety and improved outcomes for these girls. But how do you measure these things? They sound very abstract. How do you quantify that? So, as an example, improve family engagement. You might look at the number of engagement attempts. How many family nights have you done? What's the protocols for staff engaging youth? And you can look at it through youth and family surveys. To look at case plan quality, you can look at the length of time that takes for staff to create case plan. Maybe before your initiative, it take 30 days, and now it takes only 7, and that would be an improvement. You could do a qualitative review on the case plans to see if services in the case plan are actually matching youth needs. If the case plan says this kid needs mental health services, did the kid actually receive mental health services? And then for system collaboration, maybe you want to look at frequency and information communicated between systems. Or maybe through a stakeholder survey to see if they feel like they are talking to each other more and sharing information. What about quality of services? You could, again, do a youth and family survey. They're on the receiving end of the intervention, and generally they have a good sense of how things are going. And you can also look at staff's adherence to policy. If the policy says the staff should be reaching out to family at least once a week, are the staff doing that, or are they doing it once a month? Youth treatment needs. You can look at the percentage of youth who receive services according to the case plan. And again, youth survey and family surveys are always helpful to gauge their perspective. And then for public safety, recidivism is always the one big thing, provided that all your agencies working together have a common definition to quantify recidivism and recommitment. And for youth outcome, you might want to look at youth well-being. We have talked about this before in education and drug and alcohol use, etc. But make sure that the youth outcome that you're measuring are actually they're receiving these services. If the services has nothing to do with education or mental health improvement, then you shouldn't be expecting that area to improve. It's only when you're looking at the outcome, it's only looking at the outcome that's related to the services that you're providing and that you're evaluating. So this is a flow chart. And here we have more of a box. It's exactly the same thing. You have one of your goals here, and this is looking into more details. You will see the partnerships that's required in order to improve information sharing and system collaboration. You have the staff that's required, the knowledge, and technology. And then you have your target population. You also have any deliverables that's needed. And here, for the outcomes. So initial outcome, if you are reviewing information sharing, a logical next step is you have an analysis of how the collaboration is doing, and that in itself is a way to kind of quantify it. It's yes or no. Yes, you have analyzed the system collaboration and identified gaps, or no, you have not done that. And so once you establish the need and service gaps, You look at protocols that needed to improve communication, and has that been done? Do you have a protocol or do you not have protocols? And of course, there are other ways to gauge that too, but this is in itself pretty simple and straightforward as well. And then looking at the ultimate outcome to improve collaboration between agencies and eliminate service gaps. So this is taken pretty much straight from the goal, because my goal should be my ultimate outcome, what I ultimately want to achieve. And so here you have more of the abstract language for the ultimate outcome, but here you have your actual measurements. So in order to gauge collaboration and that service gaps have been eliminated, I can look at the number of services that you have as options. Are there increased number of services? Are there increased frequency of communications between agencies? So here you're listing out what can be accomplished, and the bottom is how do you measure these accomplishments? And that's all logic model is to set your goals, set the resources you need, set the activities or action steps that you need to accomplish it, and examine your outcomes step by step. And here, this is just an empty logic model chart. And that is it. I'm just going to check on the questions. And if you guys have any questions, feel free to enter that. Yes, so I'm sorry. So one of the questions is if this information will be shared online. So we have been recording this webinar and we will upload it, and then we will also turn the PowerPoint into a PDF file to send it out to all the attendees. And I guess we finished early, and I don't see any additional questions. So feel free to contact us if you have any concerns or have any questions related to any of these. Thank you for participating and have a great day, guys.